we received feedback last year that I actually thought was interesting. I know many of you on the phone on this call have been to prior Odyssey events, but we also want to make sure that those that are newer or have been lurking and don't quite yet know how to collaborate understand the intent of what we're doing with our Odyssey symposia and specifically with the Collaborator Showcase. And the feedback that we received was some people felt like it was somehow intimidating to submit something because they felt like they needed to single-handedly do breakthrough science in order to make a submission to the Odyssey Global Symposium. And so what I want to do is as Craig is setting up our breakouts, I just want to encourage all of you to be thinking about lots of different ways in which you can consider a submission to the Collaborator Showcase and how all of that is actually valuable to the bigger picture. On the screen here, I'm just highlighting the graphic that George used in the publication a couple of years ago to reinforce that Odyssey is a lot of things to a lot of different people, and putting all of the pieces together, there is no expectation that any one individual is doing everything. Actually, quite the contrary, there is an expectation that no individual is doing everything because it's just not possible. But rather, what we are trying to do is create a place where we can advance Odyssey's mission, which is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And we do that through collaborations in community data standards. So there's a lot of opportunity there to make your contributions and to identify collaborations that are in the data standard space. There's also opportunities to contribute and collaborate in open source development. There's opportunities to contribute and collaborate in methodologic research, and there's opportunities to contribute and collaborate in clinical evidence generation. Now, the way that we're trying to establish this is that Odyssey's data network, as a distributed data network, means that anybody who has access to source patient-level data, who decides to be on this journey to standardize their data through some ETL process into the OMOP Common Data Model and use Odyssey tools, has the opportunity to participate in network studies where lots of different databases have similarly joined that journey. And when we run Odyssey network studies, that really just manifests itself as a pre-specified protocol with an analysis specification, frequently using our open source tools to facilitate the idea that any data partner can execute an analysis, share back aggregate results without exchanging any patient-level data, and that we can collaboratively interpret those results and determine the best path to disseminate the findings. When we talk about the Odyssey Symposium and the Collaborator Showcase, every box, every arrow, every component of this overall framework is something that we want to hear and learn from all of you about. And so if you are somebody who's working in open community data standards, maybe you joined the journey with Claire and Melanie during our April Olympiads, and you're making progress on either thinking about the evolutions of the common data model, thinking about conventions, thinking about vocabulary, thinking about progress of ETLing your data into the OMOP Common Data. We want to hear from you, and there's lots of opportunities to present in terms of posters, software demos, or being selected for a lightning talk. Similarly, if you're a person who is working in open source development, there's lots of great tools that the Odyssey community collaboratively has developed, but there's also, as we saw at DevCon, there's also lots of great work that's kind of outside of the core stack within the Odyssey community that's being developed. And we would love to see those innovations and improvements. And software development doesn't just have to be that you're the sole owner and contributor of writing the source code. This can also be your experiences with using the tools, your suggestions of improvements or ways to think about connecting pipelines together. And that's all fair game as it relates to Collaborator Showcase submissions. We certainly want to hear from you if you're doing methodologic research, and this could be in any aspect, whether it be thinking about how to do standardized characterization and how descriptive statistics can actually lend credence to work that you're doing, whether it be in causal inference or elsewhere. This could be specific innovations in methods for for doing population level estimation, whether it be George's presentation at BEST last year, which was previously something that was presented, thinking about small sample sizes, or whether it be work in thinking about methods of causal fairness, like Lin Ying just published on. There also is quite a lot of good work in methodologic research in the prediction space, and AIC just had a really nice presentation talking about fundamental evaluations of alternative methods and how well they apply. Any work in that space, whether it be big or small, is a great opportunity, and there's lots of open questions that we constantly face that really need to start with a project that can either be done by an individual or done by a collaborative team. Of course, we're here as a mission to generate clinical evidence, and we want to see clinical evidence generated. And I think in this specific context, I've gotten feedback of sometimes confusion about this. Oftentimes, so we're not a clinical conference where we're like specialized in one clinical subspecialty. So we're not, with our partnership now with Jack and thinking about all the great work that Mark and others are leading with Legend Diabetes. One could say, like, we are generating important work in diabetes, but we're not a diabetes conference. However, that doesn't mean that you can't come and say, here's what I've learned about diabetes, and here's where real-world evidence should fit in diabetes. We actually want those stories and those messages to be shared for two reasons. Not only to share the evidence because we need to get it out there, but also because other people are going to learn from your experience in your clinical subspecialty and think about how they can apply those lessons to other areas. And so we definitely want to see that. If you're a data holder and you are standardizing your data and you're on the journey of converting your data, there's always a great opportunity to present what you've learned. And we've actually gotten quite a lot of positive feedback, particularly at the European Symposium, about how people having a poster and presenting what they've done, getting those interactions with others who have been on that journey alongside them and to share and learn from that experience is a really great way to engage in the community. And similarly with applying Odyssey tools, we have a whole wealth of feedback on the forums and whatnot about that our tools are not necessarily the easiest thing to use, and sharing that experience, good, bad, or indifferent, but sharing the experience to learn so that others can learn from your experience and that you may be able to learn from others' perspectives about it is quite helpful. And of course, we all want to be in the game of disseminating evidence, and presenting a poster or a lightning talk at the symposium is a great way to be on that trajectory, whether you have academic interest in a publication or you're just trying to figure out how to craft a cohesive and concise message to share what you've learned with the broader research community. So really want to encourage all of you, whether the work you've done you feel like is small, or maybe it feels like it's still work in progress and you're not ready to be for prime time. Anybody and everybody is encouraged to submit to the Odyssey Global Symposium. This is really a place for our community to collaborate and work together and learn from each other's experience and share each other's experience so that we can collaborate together. And really the session that Craig's about to kick us out to, really want to use this in the spirit of everybody sharing their thoughts, sharing their collaborations, and maybe finding a new friend and a new collaborator that you can be thinking about how you're going to work together, not only over the next 3 weeks before the submission deadline, but more generally, how you can be learning from each other and getting ready for the Global Symposium so that you can foster even further collaborations.